Here are 10 Puerto Rico Medical Board-style clinical vignettes focused on pathophysiology of disease inflammation, each with 4 answer choices and detailed explanations. Vignette 1. Acute versus chronic inflammation. A 34-year-old man presents with a sore throat and fever for 2 days. A throat swab grows Streptococcus pyogenes. What type of inflammation is most likely occurring? A. Granulomatous inflammation. B. Chronic inflammation. C. Fibrinous inflammation. D. Acute inflammation. Answer D. Acute inflammation. Acute inflammation is the early short-term response characterized by neutrophils, edema, and vascular changes. It's typical of bacterial infections like strep throat. Vignette 2. Granulomas. A 55-year-old woman with chronic cough has a lung biopsy showing collections of epithelioid macrophages and Langhans giant cells. What is the most likely cause? A. Acute viral infection. B. Caseating granulomatous inflammation. C. Non-caseating granuloma, D. Abscess formation. Answer B. Caseating granulomatous inflammation. This is classic for tuberculosis, which causes caseating granulomas with central necrosis surrounded by macrophages and giant cells. Vignette 3. Inflammatory mediators. Which of the following mediators is primarily responsible for pain during acute inflammation? A. Bradykinin, histamine C. IL-1, D. Interferon gamma. Explanation: bradykinin increases vascular permeability and is a key mediator of pain during inflammation. Vignette 4. Leukocyte adhesion deficiency. A newborn presents with delayed separation of the umbilical cord, recurrent bacterial infections, and no pus formation. What is the defect? A. Deficient oxidative burst. B. Deficiency in CD18 integrins. C. Lack of antibodies. D. Neutropenia. Answer B. Deficiency in CD18 integrins. Explanation: leukocyte adhesion deficiency, L8, is caused by defective CD18, preventing leukocytes from adhering to the endothelium and migrating to infection sites. Vignette 5. Chemotaxis. Which molecule most directly attracts neutrophils to the site of acute inflammation? A. TNF-alpha. B. IL-1. C5a. D. IL-10. Answer. Explanation: C5a is a complement-derived chemotactic factor that attracts neutrophils and activates them. Vignette 6. Chronic inflammation. A 48-year-old man with H. pylori infection is found to have chronic gastritis. Which cell type is most likely predominant in the mucosa? A. Eosinophils. B. Neutrophils. C. Lymphocytes and plasma cells. I answer C. Lymphocytes and plasma cells. Explanation: chronic inflammation is characterized by infiltration of mononuclear cells, including lymphocytes, plasma cells, and macrophages. Vignette 7. Abscess. A 40-year-old woman develops a localized fluctuant lesion on her thigh. Aspiration reveals thick yellow pus. What is the term for this type of inflammation? A. Granulomatous. B. Suppuratives. Serous. Fibrinous. Explanation: an abscess is an example of suppurative purulent inflammation characterized by a collection of neutrophils, pus. Vignette 8. Fever mechanism. Which cytokine induces fever by acting on the hypothalamus? A. IL-2, B. IL-1, C. IL-4, D. IL-12. Explanation: IL-1 and TNF-alpha induces fever by stimulating PGE2 production in the hypothalamus. Vignette 9. Histamine released during inflammation primarily causes which of the following? A. Platelet aggregation. B. Vasoconstriction. C. Bronchodilation. D. Vasodilation and increased permeability. Answer D. Vasodilation and increased permeability. Explanation: histamine released from mast cells causes vasodilation and increased vascular permeability during acute inflammation. Vignette 10. Acute phase reactants. Which of the following is a positive acute phase reactant, increasing in response to inflammation? A. Albumin. B. Transferrin. C. C-reactive protein, CRP. D. Antithrombin 3. Answer C. C-reactive protein. Explanation: CRP is a positive acute phase protein synthesized by the liver in response to IL-6. It is used clinically as a marker of inflammation.